Hello, America, and hello, world. Good morning, Filipinas. Welcome to the Teacher's Voice. This show aims to give teachers the opportunity to talk on air about their unforgettable journey and thrilling adventures, as well as share their splendid wisdom to inspire and give hope to our listeners and viewers. This show is aired by the Philippine Las Vegas radio station from the heart of Las Vegas every Saturday at 6 p.m. Pacific Time, 9 p.m. Eastern Time, and on Sunday in the Philippines at 9 o'clock in the morning. This is one of your co-hosts, Judeline F. Cañete, welcoming you from New York City, and my other co-hosts are Ma'am Pasita Ross and Dr. Marvin Gador.
Hello.
They are both from New York City. Let's have a word of prayer from Teacher Marvin.
Let us pray and bring our hearts, our minds, and our whole being in the presence of the Almighty. Let us pray. Our most gracious and most loving Father in heaven, to you we raise our utmost worship. To you we give the highest praise, and we ask the presence of the Godhead to descend upon us through the Holy Spirit, who enables us all to discern your will, your wisdom, and your plan, and your calling to each one of us. Grant us the heart of the Lord Jesus Christ so we can continue to serve him with gladness, with joy, and with strength. It is in his precious and powerful name that we pray. Amen.
Amen.
Good. Yes. Thank you, Sir Marvin. All right. Ma'am Pasita Ross, Teacher Pasit. Yes.
I've been absent for 2 weeks.
You are excused, teacher.
I'm so sorry about that. And I'm very happy to be back. And
yeah, of course. We too.
Yeah, thank you. I'd like to greet everybody, all education providers and education recipients all over the world. And we would like you to know that we are here to at least give you some inspiration through the stories of our guests. And hopefully they will inspire you so much enough that you would be able to continue on with the challenging task that is on your shoulders, God-given task of educating our students and children to be good citizens of the world. Mabuhay kayo.
Oh, Teacher Marvin, it's your turn.
Mm-hmm. Welcome once again sa ating the Teacher Voice program. This program is for you, whether you are teaching in the Philippines or outside the Philippines, whether you're teaching in the United States or some other parts of the world. We celebrate your mission here of teaching the young minds, whether you are teaching kindergarten or elementary school or high school or tertiary education or graduate school. And I learned a few of our listeners are teaching in tutorial centers or review centers. We are all educators because we are molding and helping and guiding and leading the minds of our students. So welcome once again to our program, The Teacher Voice.
Yes. And we want to greet, I want to greet our teachers back home and even here in America. And being a teacher is not just because we are in the classroom. We can even somewhere. We can be even in the hospitals or somewhere else, right? But because we are having this word education, we educate people in many, many ways. And tonight we are going to have a wonderful friend of mine who is going to share also her journey being an educator in the field of nursing. So guys, we thank you that you are here supporting us and continually watching our episodes in here, our shows. Thank you so much. And Ma'am Pasit?
Yeah.
It's time for you to introduce her.
Yes. I am very, very pleased and honored to introduce our guest for tonight. Susan Anabelle D. Gador, a nurse practitioner. Shorten ko na lang yun kasi she has so many titles. Okay.
I know.
In her career as a nurse and nurse practitioner, teaching is a part of her practice, be it at the bedside, classroom, auditorium, small group, or individual. She is a product of the University of St. La Salle, Bacolod City, Philippines, with a Bachelor of Science in Nursing. She graduated her Master of Arts in Nurse Practitioner in Acute Care of the Adult from New York University here in New York City. She's presently working at U.S. Mobile Care Group, New York, as a nurse practitioner. She is a diversified health professional with a holistic experience in clinical practice, quality research, and health education. She provides preventive medicine education to patients and community participants, precepts, and educates pain medicine fellows, medical residents, interns, and students, nurse practitioner fellows and students, and other allied health members. She is professionally and actively involved in different associations in the U.S. She was president of the Philippine Nursing Association of New York in 2010 and 2012. She is exceptionally knowledgeable, experienced, and skilled in pain management and palliative care, in which she has opportunities to speak and lecture locally and globally in the Philippines, the US, and Abu Dhabi. She, in 2022, was recognized as the National Caregiver during the National Caregiver Awareness Month for Leukemia and Lymphoma by the Leukemia and Lymphoma Society. And ladies and gentlemen, Teacher Boys warmly welcomes our guest for tonight, Susan Anabelle D. Gador. Welcome.
Welcome, Ma'am Susan.
Thank you, Ma'am Pasit. Good evening, everyone. Thank you for that introduction, Ma'am Pasit.
Thank
I
you.
know it's a lot, and I'm humbled for that introduction. And greetings to everyone, to your audience, wherever you are in the world, here in New York, United States, the Philippines, and globally. Thank you for joining tonight's session of the Teacher's Voice, a beautiful program. And they have beautiful guests and beautiful committee, and I'm very fortunate to be invited by my friend Mom Judy there. And I'm here tonight to share my experience to whatever questions they will ask. So I hope I can give as much information as they would like me to do so. So I thank this opportunity again, and I hope you can stay tuned for the rest of this hour to join us. Thank you.
Thank you, Ma'am Susan, for gracing this show with your presence. Sir Marvin and Ma'am Pasit, this is so unusual, actually, right? That a nurse and an educator, we will hear from her later how she educates patients
Right.
like us. Right? Okay.
Yeah.
So I think Teacher Marvin, you have a question. He is smiling right now.
Of course, I'm ready.
He is ready.
Okay, so Ma'am Susan, let me do the honors of asking the first question. Please share with us what made you dream to become a nurse?
Oh, thank you for that question. Well, it's not part of my CV, but fortunately, my mom was also a nurse. She's a retired nurse there at the provincial hospital back then. Now, I think it's a regional hospital, right, in existence. So I think she gave her time 40 plus years. That's many. I can't recall, but I think 40 plus years. And I have few aunts, her cousins, that were also nurses. So it's like, as a young child, you're taken to the hospital on some days that I went to Taitung High School, the Chinese school in Bacolod City. So we have a school bus. So there were times, that we don't have caretakers. So we are dropped off by the school bus in the hospital to wait for our mom to get off work so we can go home. So at that time, when we are in the hospital, we're being used by different supervisors or nurse leaders there. Okay, I'm assigned in the pharmacy. Okay, here, you take this, you go. So I go around the hospital. So it seems like, the routine of the hospital. I learned it as a childhood, in my childhood. And so it just fascinated me. And,
Wow.
entering nursing was a different world to me that now I was entering as a student and eventually became a nurse. And
That's great. Yeah. Ma'am Paset, you have a question.
Yeah. Lately ko lang naririnig ito from practitioners and from people who are health or working in a related health field. The word holistic medicine, holistic experience, holistic something. I would like you to please explain to us how you educate your patients and other people in this area called holistic medicine or holistic procedure or something.
Medicine,
Okay,
yeah.
Please. Yeah.
all right. So as a nurse practitioner, so I am a provider. That's what it is called in the United States, in America. But I think there are nurse practitioners in Australia, Canada, UK. There are nurse practitioners. So we're licensed independent practitioners that we can prescribe, we can treat, manage our caseload. So without, collaborating with the physicians, depending on which states you are regulated by the regulatory body of each state. So New York State, where I am, as long as I have passed the 3,600 hours of requirement, I don't need a collaborative practice agreement. So now, as a nurse practitioner, when you say holistic care, holistic is looking at the whole of a patient. So even if I'm a nurse practitioner specializing in pain management, back then in my many years of as a nurse practitioner, I look at the patient from head to toe. So even if you say, oh, I had a surgery in my back and my back's hurting me, why are you looking at my ears? Why are you looking at my eyes? Because there are some things that, can contribute and may have been missed. And when I approach a patient, so I give a quick look and like a survey on the patient's appearance, and something that sometimes the face is red, the eyes is red, or something there that's unusual that, okay, yes, you have pain that I have to take care, but there is something that I would like to investigate as well. So are you okay? Why is your face red? Is it itching? Because maybe it's from the medication that I have ordered that's giving the reaction. So then it's not just medication that I look at to treat the patient, it's the whole. So I say, all right, I'm into lifestyle medicine, not just a holistic word. The lifestyle medicine encompasses 6 domains. So looking at what the patients eat, because food is medicine, all right? So what we bring into our body causes illnesses. So if you're very much aware that if we eat too much of McDonald's fast food, your cholesterol will be an issue. If you have high blood, those salts will be a concern. So I would start with, okay, I look at with your food composition, your exercise, if you use any substances, how about your sleep, how about your socialization, physical activities, things like this. So I look at the patient at a whole picture, not just saying, okay, here's my prescription, here's your prescription, go to physical therapy, go take your drugs, come back 3 months later, and I'll reevaluate you. So that's not how I approach. So every day, I mean, when I was having more caseload of patients, now I work as a per diem, so it's a different story, but still the same composition of my care that I educate the patients. So let's look at your food composition. All right. So do you think by eliminating this, because your blood pressure is not well controlled, you're taking medications, not just one, but two, but three sometimes. And so could you at least try to better your food composition? I'm not going to push it for you, but it's for yourself. So I will only give examples. Okay, can you eat broccoli if you like?
No, parang ako na yan.
Good. Let's still eat Miss Saigon.
Oh, yes, I love Miss Saigon. So sorry.
So,
Okay.
but
Yes.
so that's how I educate my patients. So education is always part of my care.
Okay. But I have a question because you are
Yeah.
talking, you mentioned about, I see that you really care for your patients, but how do you educate or approach a patient who is very difficult?
Hard-headed.
That's question.
Hard-headed, doesn't
Thank
even
you for that
follow
question. Are
follow
you
the
one,
instructions.
Mom Jude? Are you one?
No, because now, Ma'am Susan, we have also difficult students,
Yes,
right?
yes.
And we have some kind of approaches
Yes.
and methodologies on
Yes.
dealing with them. How about you, nurses, on how you
Nursing, yeah,
educate
okay. All right.
patients who are very
Okay.
difficult?
Right. So again, in different field of our profession, we have challenges and issues that we face. Could not be every day, but the majority probably of our work. So it's how I face them. So, again, I present myself, I'm so-and-so, I'm a nurse practitioner. This is what I do, but how I would take care of my patients, I include lifestyle approach. So the lifestyle are this and that. So again, I am not pushing this to you. I want you to hear me, all right? And make your choice. And when your next visit, you let me know. Did you do something to change from, okay, here's the list of the food group that I want you to try. So did you try any of these food groups? So, you try to talk in a nice way, to respect them, that you're not prejudging them, that, okay, you're obese and, it's impossible. You have to stop everything now. You're diabetic.
True,
Like,
yes.
So I can't do that. Again, in pain management, we have, I have dealt with many patients that were actively taking substances. So it's always a challenge to take care of this type of patients when they come in the hospital. Okay. So it's like some of them may not tell you the truth, hide something. And then when you prescribe, it's not enough because they say, I'm trying to cheat them. But if you're not telling me the truth, when I ask questions, how could I help you?
Correct.
If I'm here to help you, I want to hear from you as well. What is it that you want me to do? So I try to involve you as a patient in the care, because it's not just my decision. It is our decision.
Okay, Teacher Marvin, you are still smiling and smiling there. You must have a big time question.
Of course. Ma'am Susan, you have a vast nursing experience that ranges from hospital care to public health to professional development as an educator, and of course, in community outreach. So what are the insights that you learned as you navigate through these different experiences? Do they have the same influence on you, or do they have the same personal impact on you? Please share your insights.
Thank you, Sir Marvin, for that question. Again, the variety of professional background that I have entered and placed myself, where, mostly the big part was really hospital settings, as probably you have read my CV. So even in the hospital settings, I've been in different, functions, say staff nurse, charge nurse, preceptor, mentor, educator, things like this, policy and procedure developer. So across wherever I go, there are challenges. So there are different personalities. Okay, so how do I deal with different personalities? So if I write policies and procedure, and some nurses colleagues will say everything is changed now, and you just walk in the hospital and you're changing. So I'm like, okay, we're working for this institution, so it is not my policy. I was hired to work on the policies and procedure, having that specialty, writing policies and procedure, and my specialty in pain management. This is what I can deliver to the hospital. It's been accepted by the committee. So now it's time to educate you on the content of the policy. So we have to follow the hospital policy. So if you want to work in this institution, just like I do, I would like to follow the same policy as well. So, but however, if you think this is not for you, maybe you should, okay?
Leave.
Try, not leave, but try to find yourself where you want to be, okay? So it's like not telling you directly that you can leave, but hello, the door is open for you. So, so then eventually, they can sense that this person, meaning me, that I'm working for the betterment of the patient, of the institution, and for everyone. So it's not for my gain. It's not to give me honor. It's not to give me credit, but it's part of my work. So let's work together. So I will ask too, if, of course, they decide to stay, I say, so you have any questions, all right? So I'm here as the expert. Ask questions, and we will work together. We will find answer. I may not know everything, but we have resources.
Okay. Thank you. Ma'am Paset.
Yes. Oh, okay. A follow-up to my first question about holistic care, holistic medicine, etc., the holistic thing. Yeah. Is that now the trend or the norm for you, people in the healthcare system, that you provide your patients something, for their whole being, not just like, I come in for my pain and then yun lang ang titingnan ninyo. Is that now the trend or the norm that you do sa inyong pagna-nurse o kaya sa mga doktor?
Ma'am Paset, that's a good question, right? So holistic medicine is not just 10 years ago. This has been a practice of all providers. So when I say providers, I mean physicians.
Yeah.
However,
experience,
right? However, I would say, history tells us that, with innovations, with advanced technology, advanced medicine. So sometimes some of us providers, I get carried away. Oh, we'll just use this equipment because I'm good with my hands. So I love technology. So I'll just insert machine and then test you, I'll put you in the CAT scan and so on and so forth. So we lose the touch assessment. So I always like to touch my patient. Okay. So where does it hurt? Okay. So I'm a different provider. I always carry my stethoscope because I'm an old practitioner. So I have to listen. It's not just looking at numbers at the monitor. So I said the numbers can tell different things because it can be an artifact. But look at the individual, listen to the individual, palpate and touch the individual. So things like this. So there are still a good number of us that does this, but that's why when I teach my students, I always want them to have this experience. I said, I may be a few of your nurse practitioner, mentor, preceptor that still teaches this way, because a few of them will express, I've been to this distinguished institution, blah, blah, blah. My nurse practitioner never teaches, blah, 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 blah. So I said, I understand. I said, but with me, it's different. Okay, so let's just do how I was taught. So I'd like to share this as well because I was mentored. I was taught well. So I said, I want to give this to you because one day, if my disc doesn't work anymore, I said, I don't know. At least I've given everything out there, and you will remember Susan did share. Susan did this for me. Susan did that. And I never keep it to myself. I said, take it out. Whatever questions you have, I'm here. I will deliver to the best of my knowledge.
Pero, Ma'am Susan, the question of Ma'am Paset, I like that. We're talking about holistic, right? So if somebody has pains, I think Teacher Paset was telling us that she has an experience of maybe Ma'am Paset, you are expecting that the doctor will refer you to another. That's what you mean?
Right. Kind of. Yeah, ganon. Unless you, you know ba, kasi you go and then they ask you, what are you here for? Oh, I have this thing, blah, 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 blah. And then that's all they deal with. I mean, they ask you about nothing else, yung bang mga ibang areas that could be, you said, could be a source, could be a cause, could be the problem, could be part of the problem. Yeah, so that's why I'm asking, isn't that or shouldn't that be the norm ngayon sa ating mga clinics, hospitals, and all that?
That should still be part of our practice because that's assessment. So patient assessment is not just focused on one area of the body.
Yeah,
so when a patient walk in front of me, I assess the patient so quickly, so do you have a headache? Do you have any ache anywhere besides the complaint that you are here today? All right. So, but because many of us, the providers, again, dictated by insurance. So this type of insurance will only allow 10 minutes. That's it. All right. So this 10 minutes, boom, 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 everything rush. Right. So I would like to advise your audience, if they ever become a patient, as outpatients, or even if they go in the hospital, or even as an advocate, make a list, okay? Write them down already. Give it to the doctor. Your insurance is paying for this, doctor. And if you're paying for cash, you demand the proper care, okay? You will not accept this rush off thing. You can, in the United States,
that's good.
Sure, in the Philippines now, or in the other countries, the United States, you can file a complaint. All right, a patient's complaint.
Ma'am Paset, you have something to...
Yeah, I like what you said. Teka, nawala ako. Yung bang, you tell them, ask them questions, sabi mo, tanungin mo sila until they, they give you a little more than what you are complaining about. Para, kaya lang, you said also insurance. So they give you only say 10, 15 minutes ka lang. Then after that, okay, so we'll see you next time. Ganun na sila So the thing is...
Doctors are like that nowadays, Tita Paset.
How do we handle that? Sa doktor natin, we have more questions to ask.
Right, so that's why prepare your questions. Prepare your questions ahead of time and research if you know your illness, if it's high blood pressure, and how come my blood pressure is not well controlled, and I follow the doctor's advice. So research already and question. There are societies, organizations that are specific to certain illnesses. It's like Lymphoma Society, that's for the blood cancer. So you go to their website, they have resources, there are tons of resources. You can get questions in there. Carry that question. So there are virtual visits nowadays too. Okay.
So you are telling us that we also do the work. We do the research.
Yes.
You are the consumer. You are the consumer. I'm not the provider that will just tell you. No, that should not be an acceptable practice. It is
okay. Thank you. Oh, this is really very educational.
Part of my education to all of you.
That's true. That's true.
Right?
I love it.
Be participative as a consumer.
Okay.
Not just say, doctor, yes, doctor. Doctors are not God. All right. We went to school. Yes, they went more years than me, but we read books and we practice on people and human beings. They may have practiced with rats, dogs, whatever animals for research purposes, but we are here to take care of a human being, a life, not an object.
Very good. Ma'am Susan,
thank you.
I know pain management and palliative care are the ones that you are specializing for. how do you educate family members of palliative, like a palliative patients, especially facing death? How do you educate or handle them?
Thank you, Mom Jude. So actually, palliative is not hospice. Hospice is the end of life care.
Okay, okay.
So, all right, just to make a clarity there. So palliative, you have years, but if you want to enter palliative, like you have a chronic obstructive pulmonary disease, so you're skinny already and you have chronic pains here on your chest because you're always coughing and, with your structures and poor healthy lifestyle, etc. So with medications, you can live years, but you have issues with pain. So that's how palliative service comes in. But however, the hospice now, to address your question, is that end of life care. So it's really challenging, especially if it's the family are not yet in the acceptance phase. So remember the grief period, right? That we go to stages. So denial before acceptance. So anger, blaming. So I used to work in a department of pain medicine. So thankfully we have services like psychologists, social workers, our religious leaders, and doctors, nurses, and a team, pharmacists, physical therapists, and many team together. So we will have a meeting with the family. So if a family have representatives, so let's talk and let's discuss this. Okay, if let's say, okay, you give it a pancreatic cancer diagnosis and your terminal 6 weeks of life, right? Or shorter than that. So we will discuss, would they like their family member who is the patient to be involved in the discussion? Because some culture don't want to have their patient to be involved in that discussion. So it's really difficult that the patient is suffering for that.
How do you manage, like with religious involvement? Example,
so you have
right?
to respect. You have to respect the religion.
So how do you manage that? Because let's say, mentioning Seventh-day Adventist, right? They don't want this. Like, there are many restrictions in their part. So how do So how do you manage them?
So we have religious leaders with us, so that they can talk and give that discussion. All right. So how far would you like us to discuss? All right. So this is terminal and everything. My role will be purely clinical provider because of the team care. So it's not just an individual care. It's a team care. So it's only mine is okay. So the drips, things like that are to be ordered. But other than that, the other member of our team, of our palliative and hospice team, will take that role to further discuss and speak to the family member and try to get their consent.
So you are saying that it is always the patient's side, whatever they wishes or whatever they wish. I mean, you guys should respect it.
Right. United States. I mean, again, I'm quoting on the United States, the Patient Bill of Rights, right? So the right of the patient to know is the right of the patient to complain. It's right. There's few rights that the patients have the right. So we cannot just say my right. So I cannot enforce. I have to ask the patient. So if the patient can speak and mentally okay, so I have to get the involvement and the plan of care. So what would you like? All right. So this is my plan. Is that acceptable to you?
Mm-hmm. Okay, Sir Marvin.
Mm-hmm.
More questions?
Of course. Ma'am Susan, you mentioned in your bio note that you work as a mentor and a preceptor. I know a lot of nurses, friends who are into the nursing practice, but this is actually the first time I heard about the role or a job of a preceptor. Please describe to us specifically what a preceptor is, and how important is this role in your practice of nursing?
Okay. When I was a staff nurse, when you gain a little senior status, then when a junior comes in, the junior nurse will be assigned to you and say, okay, you shadow this preceptor. So you are called a preceptor because you're going to show the person. So let me give an example that one of my staff nursing background was in the recovery room. So what is the recovery room? What do we do in the recovery room? What policies and procedures there are? What types of patients do we take care? So let's say if I work here, when I came here in the United States, when I work in a trauma center, a gunshot type patient, I'm just going to pick up what gunshot patient. So if that's a gunshot with a big injury, so major organ injury. So let's say had a lot of blood loss. So now we have to transfuse blood. There are breathing machines. So how to set up a breathing machine, how to understand the dials, the different numbers and settings of the machine. So you teach the new nurse. All right. So besides just teaching and showing them, you give them resources. So like your policies and procedure, like your literatures that could be referenced to that, and you ask them to read them at their own time. All right. Because right now we're going to take care of the patient. So you shadow me. So as the patient arrives on the operating room, these are the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 that I do. All right. So later on, I will ask you what did you observe and how comfortable are you? Because on the next patient now, I want you to do the admission. I'm behind you, but I want you to connect the patients to the monitor, do the lines, do this and everything. So you teach one and they and they show it to you, and we have a competency checklist. So are you competent in setting up a ventilator? Are you competent in hanging this type of medicine and monitoring the side effects? Those type is a preceptor.
So basically a mentor.
Okay, a mentor.
It's a mentor. Is it a mentor?
No, that's preceptor. Precepting is a body. It's a body.
What is the difference of mentorship?
Okay, so now I mentor. All right. So my mentorship, they are not coming to the clinic. So it's like a mentor undergrad student of NYU, the New York University, and graduate student, but that's outside of the institution. So they can make me as a resource that they have been to the clinical area and they had a situation and they feel uneasy. They have discussed it with their clinical instructor, the nurse that they were assigned to. However, it seems like my student nurse is still not satisfied of their responses and what was done to the patient. So then I, as a mentor, the student nurse lists all these questions ahead of time, because we can meet once a month or twice a month, depending on her needs, and say, oh, by the way, Susan, I encountered this. What would you have done in this scenario? Okay, so I may have a different approach. And she said, oh, wow, yes, your thinking is different from what I have seen and the responses. So I said, okay, so maybe it's because I had that experience that I bring something to you that's different. And as I have taken care of that many patients of that type, more so, but this mentor is outside the hospital that I worked. It will be now, we do virtual, so we screen on the phone.
Yan pala ang nurses, no? In their days of schooling days nila, mahirap-hirap pala, no? Dahil life ang inano nila eh. Life is the one that they are dealing with. So they have to have this mentorship and then internship, somewhat like that. Like us in the teaching profession, like teaching the classroom, it's not like life and death situation. So I would say na Ano kaya? Ma'am Paset, heavy din ang sa atin or mas heavier ang sa kanila? Dahil tayo, life ang atin, we are molding life. Pero sila, they are dealing life na life and death situation eh. What is your, what
Yeah.
is your feedback on that? Huh? What can you say?
Yeah, yung kanila is like, to prevent the loss,
Uh-huh.
prevent the loss of life. Tayo naman to
Build up life.
that life. Yung future ng mga bata
Oo,
natin.
no?
So, magkapareho in a way,
Magkapareho.
but different in other ways too. Pero
Yeah.
still, Susan, I really commend you for being such a good educator, no?
Thank you.
Yeah.
Seems to me like I don't know. I have a question. In which side or in which situation are you happier as an educator in a clinic, in a room with somebody, a sick patient, or as a teacher, an educator in an auditorium full of medical and health providers and other professionals in the same area, or community people, regular lay people, I might call them, hindi sila mga doctor or nurses or anything. In which situation are you happier, do you think?
Well, that's a very nice question, Ma'am Pasit. But my answer will be, it's the same wherever I go. That's for me.
Okay.
So
Okay.
I'd love to. Teaching is always part of my daily care as I go to work. So they would always.
I can sense it.
So don't
You
let
love to
Susan
teach.
yourself and find something, because part of incident that I will find, mishap sometimes, I will re-educate you, because, we have to prevent mistakes. As you said, yes, my career involves life and death situations.
Mm-mm.
So I don't want to harm an individual. So my goal is always safety first, okay?
Okay.
Second, of course, is your license. If you have 10 other licenses besides nursing, go ahead, drop nursing and move on to another licensure practice of what you want to do. But, if it's only nursing, I would like to share to my students and to the audience that, when you are deposed, which that's part of my experience, I've been brought to not a big court, but in front of a lawyer of the patient and lawyer of the hospital. So deposition, you are questioned according to what you have written in the chart. And as an educator and writer of policies and procedures, so, they'll ask me questions. So you write the policies and procedure. Did you educate? When you educate, do you have a documentation?
Wow.
Did they sign off that they understood that policy? So, there's proof, because it is mandated of them to sign off. And when I make rounds, my patients, I will ask the nurse, okay, so come tell me, how would you assess the patients when the patient has this? What are the common side effects of this medication when the patient has this medication? So when do you call me? What would you do when there is a side effect? So I question them. So that's part of education. So sometimes, some nurses would feel, oh, I'm strict and so on. I said,
Yeah.
no, if you find me strict, but I just want you to do the right thing, because
Yeah.
this is life. This is not
I
a
have-
life. Yeah.
I'm sorry. I have this question. There are also nurses. They like hospitals, right? And they like also like visiting nurse. Visiting nurse. Why is it like that? What is the load of work in the hospital and compared to visiting nurses?
Okay, so to my experience right now, I work in the U.S. Mobile as a per diem nurse practitioner, so I do home visits, right? So, but of course, bulk of my career was always inpatient, which is inside the hospital. Even the outpatient was still part of the hospital setting. So in the hospital, you are timed, right? 8 hours, if that's your 8-hour shift or 12-hour shift. So you are assigned certain load of patients. But as a nurse practitioner, I have larger load than the staff nurses because I was a consultant. So I have to consult wherever I get the calls all over the hospital like that. But, again, time management is a thing that you learn through many years of experience. So, I developed that, and the trust that you built with the nurses, with the doctors, with the residents, and everyone in the hospital, that they know when they call you over the phone and you respond through your phone because you're attending another patient, they know that I'm coming, but I could order over the phone and enter it through the computer. All right. In the meantime, give this medication. All right. Do this to the patient, but I will come to reassess the patient. So that part. And now the home visiting. So the home visiting, they're given a load of patients, but could be less than the number of patients in the unit possibly. All right. So because of the location. So let's say, all right, so today you're not just going to Brooklyn. You may be from Brooklyn, you go to Queens, you go to Manhattan. So you have 3 locations. Are you driving? Are you taking local public transportation? I'm just quoting in New York, right? So those factors affect the number of patients. So like me, if I'm assigned to areas in Manhattan, can I just take a walk? Is this just in my neighborhood? Or do I have to take a bus, or the van of the company will take me to an area where, it's farther out, and then we go to Queens, we go to Brooklyn. So the traffic alone in Manhattan, well. So it takes the whole day of your time already, and I still have to enter my notes. So those are different, and you are paid. I think for agency, I'm not a different category of payment, but for nurse, as a registered nurse doing home visiting, they may have hourly rate possibly that they say, okay, if I clock in 8 hours, then you're clock in. If I work and they say I end in 6 hours or 4 hours, that's me. I'm done for the day. I'm not mandated to stay for the whole 8 hours. So it varies as a nurse practitioner. Some of nurse practitioners are independent. They have their own practices. So they can work 10 hours, whatever, weekends, nights, whatever, because they control their business. I'm not that kind of a nurse practitioner. I work for a company.
Okay. We have one more because we don't have much time.
And I have the last
maybe
question.
Ma'am Paset. Okay.
Yes, please. Thank you so very much, Susan. I think, you have educated us a lot about your field, your area, And I must say that you are a very effective educator in your field. Okay. Now, I have a question. You have this very, very, very hard, difficult day. You had a patient who is about, who's almost at the end of the road, You come home. What do you do? Can you educate us how to de-stress or
manage?
At least, because emotionally, I am sure you're so drained, emotionally and not only physically. So what does this nurse practitioner do to,
de-stress,
reinvigorate yourself?
Thank you. All right. So of course I come home, I take a shower. So that alone, warm bath is good enough, right? So it relaxes your smooth muscles, your nerves, things like that. And if I catch up the virtual mass in Bacolod, in home site where my family are from, so I, open and attend the service as well. And part of my active nurse practitioner role outside of this home, I am also a full-time caregiver. So I don't know if you have picked that up, but I'm a full-time caregiver to my significant other who is in remission for his cancer. So it takes something and some good time for me because, I prepare our meal, but not every day. I prepare it in batches, but I have to like lay out, all right, this is our dinner, this is the et cetera. I clean up and things like that. Then, I have meetings oh my God, many nights. I am involved with many professional organizations, as you see in my CV. So depends on which professional organization have meetings. So I will schedule myself to participate, a webinar meeting, etc. So the Philippine nurses, I'm an active advisory council member. So I have some committees that I get involved, and in our regular meetings, I participate as well, and a few other professional organizations. So I get busy. So sometimes, that moves me out of my work, my thoughts from work. But again, if I have to see that patient the following day, prayer is part of my daily living and practice. So I thank God for everything that I have and I receive and I give, and to all of you.
Well, thank you, Ma'am Paset. I have a question to you.
Me?
Yeah. Why? If you have a student giving you a problem, when you go home, what do you do, Obe? Ikaw, Tita Paset. Ewan ko kay Sir Marvin. We will ask him later.
Magwawalis ako. And then, or, binging. Food binging.
No.
Music or walk.
Music.
So many different ways, actually. Many different ways. Thank you.
Okay, Teacher Marvin, what do you do?
Yeah.
Well, coming from a stressful day, coming home to my family is one big thing, and just going home with my family, it already eases my stress. And whenever I go home stressed for the day, I clean the house.
Oh yeah. Good.
Oh, si Susan.
Wala bandera pala tayo.
She's cooking. Like cooking. Me too. I love cooking. I will just cook. Yes. Wow, this is so cool. Susan, thank you so much for your expertise and sharing all your stories, your journey. Wow, this is so inspiring, very, very rich story. And I think we have something to. If you have a message to new graduates of nurses, what will you tell them, Susan?
All right. So for those new nurses and for those thinking to be a nurse, all right, welcome you to the profession. Okay, such a beautiful profession, humbling and compassionate. All right, don't think about money. Money, yes, it's part of the deal. And as a professional, you will be paid. So, but we have a service to humankind. All right, so we have to focus and think that we are here for that profession. So do not be afraid. Take challenge, take criticism openly. Welcome new opportunities. And open the world to everything, because you cannot just be in here. You could be everywhere, as the song goes, New York, New York, right? I don't know how to sing, but you could be everywhere, which, one time I had moved myself, not moved, but I was invited to work in Abu Dhabi to practice as a nurse practitioner there instead of a pain management, so which I never imagined in my whole life here in the United States. But that was a very opening and a great opportunity that I was able to give what I learned and my experience. And, I set up a good name and a good legacy when I left the country.
So you are saying if you are a nurse, wherever you are, you will have a job immediately.
Yes,
right, guys? If you are a teacher, you can have a job immediately. That is true. So be a nurse and be a teacher. If you're not a nurse, you can be a teacher. Wow, this is so cool. Teacher Marvin, you have something to leave words to our listeners.
Okay. Instead of leaving my life quote, I just want to add to respond to the question you asked about the responsibility of nurses over the lives of their patients, in the same way as teachers also have their responsibilities over the lives of their students. Before I became a licensed teacher, I was a licensed medical technologist. And so coming from that perspective, I realized that whenever medical practitioners commit mistake, it costs or it jeopardizes, the mistake jeopardizes the well-being and even the life of the patient. But whenever a teacher or teachers commit mistake, they would just simply erase the board. So there is a greater responsibility in there.
Yeah, that's true. Yes.
I just
Teacher
want
Basit, you have something to
Okay, yeah.
add more.
First of all, Susan, congratulations on your perspective, your nursing perspective, and your perspective as an educator. And I really wish that we will have more of you in the field, and then for our listeners tonight to have learned a lot. I learned a lot, I must say that. And then about how you should approach your health, your doctor's visits, whatever it is about your
your care,
physical, your medical needs, and all those. So thank you, Susan. It was really a very eye-opening. A lot of things I learned from you. Thank you.
Yes. This is the thing. Teacher Pasit and Teacher Marvin, lately I have been associating myself also, not just only educators. No, my group is more on educators like you guys. But now that I am with these people, with also with Dr. Marie, remember last week, right? My knowledge became more and more. And I love being with them also. That's why I invited them to share also their experiences. Maybe next time, accountant can come here and tell us about how they educate people also when it comes to financial. And we need that. We need that too, right? Okay. So nurses, we love you. We love you because you care for us.
Yeah. Right.
You care for us. And let us not be weary of doing right, doing good things, because in due time we will reap it if we will not give up. Thank you so much, Susan, Teacher Pasit, and Teacher Marvin.
Thank you.
Thank you,
Guys,
to all of
thank
you.
you.